Welcome back. This is part 31 of things that your vet staff wishes that you know, and in this video we're going to talk about hip dysplasia. Hip dysplasia is essentially when the ball and socket joint in the hip is loose, malformed, and ill-fitting. Because of that, it allows a lot of movement that shouldn't be there and leads to a lot of wear and tear and inflammation and eventually arthritis. This most commonly happens in large breed dogs, such as German Shepherds, Labrador Retrievers, Golden Retrievers, Rottweilers, Newfoundlands, and St. Bernards. But it is not just limited to them, because technically it can still happen in small dogs and cats too. Larger dogs are predisposed to this because they are larger and have more weight and more strain on the hips. The severity can vary a lot, and it doesn't always look dramatic, and it's not always your older pets either. Sometimes you may not really notice any signs until later in life when the arthritis gets really bad. There are several signs you can look for, and I'm going to read them from this little note that I wrote, because I know I will not remember to mention everything that I want to otherwise. That can include difficulty getting up, stiffness, reluctance to run, jump, or climb stairs, hind end weakness, limping or lameness in the back legs, bunny hopping while running, swaying through the hips, decreased muscle mass in the hind limbs, shifting weight forward to the front legs, and lower activity level overall. Diagnosis comes from history and clinical signs, exam with palpation and manipulation of the hips, and x-rays. X-rays are a huge part of confirming diagnosis and assessing just how much arthritic change is present. Treatment can be anything from weight management, pain control, and physical therapy rehab, all the way up to surgery in severe cases. There are things you can do that could potentially prevent hip dysplasia, but at the very least lessen the severity of the case that your pet gets. Number one is responsible breeding. Hip dysplasia is strongly genetic, so the biggest prevention actually starts with responsible breeding and screening the parents. Dogs with severe hip dysplasia really should not be breeding. Number two would be keeping weight off of them and keeping them lean, because more weight means more stress on those hips. Number three would be keeping them active and avoiding high impact play, because strong muscles are going to stabilize and protect those joints. Number four would be starting joint supplements relatively early. This will not prevent hip dysplasia, but it could definitely lessen the severity of the case they may get and improve their joint health long term. And the last one I will mention for this video is early detection. This one could arguably be the most important, because catching it early means that they get treated early, and that can slow the progression of the disease, keeping them more comfortable. I'm out of time for this one, so let me know if you have any questions or suggestions. Love you guys. Bye.